I'm preparing to live stream, just so you guys know. Should be on the YouTube channel in like a minute.
Thanks for the warning.
Yeah, so behave.
The revolution will not be live streamed.
Yeah. Okay, we're live.
Are you gonna sing Prince for us? That would be fabulous.
Actually, it was Gil Scott-Heron.
Oh, the original.
Mm-hmm. Played it
Thanks,
many
Roger,
times.
for clarifying for us.
Yep.
All right. It looks like Rena there she is. We got people popping in and popping out. Okay, so since we're on, I'm going to call the Public Health and Human Services Board of Tuesday, June 16th to order at 8:31 a.m. And for those who are unaware, just a reminder, we are still in the throes of COVID meetings. So we do have the ability to do the meetings by Zoom in order to keep all of our citizens safe, happy, and healthy. So we will do a roll call, and I'll kind of start with the ones that I know can hear us and we can hear them. Andrea?
Here.
Thanks. That was a blooper. Roger?
Me too, here.
Dave Mills?
Here.
Myron?
Here.
Jenny?
Good morning.
Good morning. So Ginny's on the phone, just so all of you know, she's not on the video. We also have our director, Allison, on. We have Grace Grenager on with us. We will have Bobby and Rena on shortly. I can reach Bobby on texting, but we do need to have him on camera and live. So we might do a little dancing here for a little bit to make sure we can get him on. We have County Attorney Hicken coming in with us. Anita, we have you on this morning?
Yes, I'm here. Thank you.
Yep. We have Sarah Hadley manning the controls for us this morning. And then while we wait for Rena and Bobby to get back on, we will do an introduction of our newest employee to the Public Health and Human Services team upstairs, and that's Kristen Diaruta Wharton. Kristen? She disappeared for a moment, but I'm sure she'll be back. Good morning, Molly. We announced that you're here. You can just wave if you don't want to unmute.
Hi, everyone.
Hi. All right, Kristen is unmuted. Kristen, introduce yourself for those who have no idea who you are and have been under a rock for decades.
Good morning, everybody. So I'm Kristen Diaruta Wharton. I'm really happy to be accepting and now starting this position as public health educator, working alongside Grace Grenager and the team at PHHS. I have actually this week is my 20th anniversary of living since I moved to Cook County. So woohoo! And I have about 15 years or so of local healthcare experience and public health in Cook County and elsewhere. So thank you all. I'm really excited to work alongside you and be back on the home team.
And just a reminder for those that have not been tuning in or have been elsewhere or have been hiding under COVID precautions, we hired Kristen to work with Grace. So Grace will be her direct supervisor and just expanding that program. If you do not know, Grace has got meetings and meetings and more meetings and does a lot of education for the community, and Kristen will help out with that. And if you know Kristen's history, that is her expertise. So we will have the dynamic duo getting as much possible information out to the community and making sure that you are all happy and safe and healthy and know what's going on in your community, along with teaming up with Andrea at the SHIP program. It will be amazing. Rena, I see you there. Can you now hear us and can we hear you?
Couldn't get sound through my computer, but we're on the phone call. So we're one of those phones.
So we can see you and hear you.
I don't know why I went into technology because I really hate messing with stuff, but There you go.
Okay. All right, so that makes the full team here. We will hop back to our agenda. Can we get an approval of the consent agenda?
I move to approve the consent agenda.
Thank you. Can we get a second?
I'll support that.
Thank you, Myron. We'll go to roll call. Ginny,
Aye.
Roger,
Aye.
Andrea,
Aye.
Myron,
Aye.
Dave,
Aye.
and I for me. That is all ayes. Consent agenda
Wait,
goes.
excuse me, you forgot Commissioner DeShaw.
Oh, sorry, he was on the phone behind you. Commissioner
I
DeShaw, you
know.
are back in there. Thank you. Sorry, I didn't want to put you on the spot if you were taking an important call. Staff report, Anita, you are up.
Hi, this is Anita Josiah, coordinator of the in-home support program. And thank you for inviting me today. I really appreciate it. Just a quick congratulations to Chairman Deschamps and also Kristen, Chairperson Deschamps now at the Tribal Council. So I'm going to share my screen here. Again, I'm Anita with the Cook County In-Home Support Program. And let's see. For some reason, it's not moving forward. Okay. Oh. I'm not sure why the PowerPoint is not moving forward. It was working fine before I started, but you do have it in your agenda. There's a copy of it partway through. I don't know, Sarah, if you have any advice. I have tried page down, I've tried the arrow down, I've tried enter, and I've tried the
Looks like it's not presenting on your big screen, Anita. If you did you put it in presentation mode?
yes, it is. It's in presentation mode on the big screen.
We're not seeing it for some reason.
Okay. Let me try something else.
Here's your keys up in the parking lot.
Thank you.
That's right.
So, did that bring it up?
Yep.
Oh, yay.
Got it.
Okay. But it, oh. Okay. So what does the in-home support program provider do? We are a licensed program through the Minnesota Department of Human Services, Minnesota Statute 245D. So part of the challenge is keeping up with licensure requirements and ensuring that our program is consistent. I will enroll new service recipients and maintain clientele, hire, train, support, and supervise service providers, initiate and match service recipients with providers, and manage that part of the program, review and authorize service provider billing. Each month they bill the county for the services they've provided. And I participate as a public health and human services and community team member to best serve clients. And of course, paperwork, lots of paperwork as always with these kind of things. Who do we serve? Any Cook County resident who is age 65 or older is eligible for our program, and any Cook County resident with a permanent or temporary disability as well. what we do, service providers will go into individuals' homes to provide cleaning and organization, meal preparation, transportation. They'll run errands for individuals, drive people to medical appointments. Sometimes we provide respite care when there's a need for that. Companionship and personal support are usually included in all of the above. And this is because individuals, it's to help enable the individuals to be able to stay in their homes because these tasks have become difficult for them to do on their own. There are a few different payment options for the program. There are several waivers. And under the waivers, it depends which waiver the individual has as to what the payment is. For alternative care and elderly waiver, they receive $19.36 an hour. For other waivers, it's $18.44. And this is as independent contractors. So we do not take out any taxes or Social Security. They do not receive any benefits through the county. All of that they have to provide on their own. So the waivers, depending on the waiver, can be for any age if the person qualifies for the waiver. Some individuals are able to private pay, and usually they will pay between $20 to $25 an hour. And as long as they meet the criteria of age 65 or older, have a disability or chronic illness, they would be eligible for the program. Some people are not on a waiver and are not able to private pay. So then we have a sliding fee scale and we base that rate on the lower rate of the waivers. Sliding fee scale is only available for those who are 65 or older. And then in some situations where maybe it's a person who's under age 65, but they have mental health issues that prevent them from being able to perform the tasks that our program covers. Occasionally there are several individuals for whom adult mental health funds can be provided. So right now we have 49 service recipients. We had 50 through the winter, but one moved on recently. We have had some referrals over the past couple months, but we've really been carefully screening those because of COVID-19 and have not taken any new referrals at this time. That may be changing soon. That's where we're trying to keep protocols consistent with the current atmosphere. So right now there are 13 waiver clients, 19 sliding fee scale clients, 13 private pay, and 4 adult mental health. And you can see we're spread out around the county, both service providers and service recipients, especially in Grand Marais. But we do have some of both on the West End and East End as well, with 15 service providers. So the challenge recently, of course, has been COVID-19. So keeping up with the constantly changing needs and expectations. For instance, right now we are in the process of establishing transportation. We had put medical rides and errands on hold as there was the stay-at-home order, and I've been working real closely with Grace Grenager, Grace Bouchard, and also Allison McIntyre to iron out a protocol with safety in place for resuming some rides. And service recipients are very anxious for that to happen. Also just ensuring that service recipients' needs are being met, including the option to suspend services. There have been 12 clients, actually yesterday one has said, so probably 11 now, who have been postponing services because they don't want to risk someone coming in their home, and they're able to manage with help of friends or family or just do what they can. And with the grocery stores, of course, having delivery and so on, some of the service recipients have chosen to postpone services at this time. Also, service providers, a couple are currently unavailable due to various reasons related to COVID-19. I should just say what those are, I guess. One has been driving back and forth to the Twin Cities every other weekend. And so because of the larger number of cases in the Twin Cities, we had suspended services temporarily with her. And the other one, once the stay-at-home order and closure of school happened, she had children at home. She didn't have childcare, lack of internet, and just a lot of challenges, and in the process of moving. And so other service providers have graciously picked up and helped with the clients that they were working with. And then also just making sure that service providers have the supplies they need. We are, for instance, requiring that they wear masks. So through the EOC, we've been able to provide cloth masks for all of the service providers. And prior to that, through some specific donations, we were able to provide paper masks. So some changes, we are asking service providers to call and check in with service recipients prior to going to their home. Asking, as I'm sure you've probably seen, the COVID-19 screening questions to make sure that both service provider and service recipient don't have any symptoms or exposure, so that they, as much as possible, are safe with each other. As I mentioned earlier, errands have been performed on the service recipient's behalf, and we are working on a protocol that should begin probably within the next week or so to begin offering errands again with the individual going along. Medical rides also, we have limited those, and there was a committee, a Transportation Support and Logistics Committee, that was meeting for a while with several representatives, including Care Partners and Grace Conager. And so we've been, as a county, trying to do what we can to ensure that people's needs are met. And then in the home, and this can be challenging. Pardon? Some people live in very small spaces, and so the service provider and recipient are very conscious and careful to maintain the 6-foot distance. Service providers are expected to wash their hands frequently or use hand sanitizer if they're unable to wash their hands frequently, and then also to wear masks. Lots of communication in this time because of just the complication of the situation. So administration has regularly been communicating to myself and everybody in our department as things come through. What is the Grace, for one, Grace Conager, every week at least, she sends out the updates about where everything is at regarding COVID-19. And then I participate in committees too, such as there's a committee with the Arrowhead Agency Area on Aging. So we collaborate together as partners in this part of the state to talk about what each other is doing and how we're moving forward and how we're meeting people's needs. Had been meeting once a week, now we're meeting every other week, and that's by Teams, which is similar to Zoom. I also collaborate with administration, and we work on developing protocols and procedures, such as the transportation one. We also are in the process of rolling out an exposure policy too, as far as if a service provider or recipient has been exposed or diagnosed with COVID-19, what will the procedure be? And then I communicate regularly as things come through with the service providers and recipients. As far as how I communicate with service providers, regularly by email. At first, it was almost daily as things were just being presented and we were learning so much. But when I learn new things, anything that might be helpful to them, even regarding like unemployment insurance, if that's a need that they might have, or childcare, or anything that comes through that's unique and special during this situation, I will pass on. Have been sending letters and flyers to both service providers and recipients as appropriate, not overkill on that. And then when as needed, a couple times early on, I went through the list and called all of the service recipients to talk and talk through how this was affecting them, and just checking in, and then as needed from there on. Overall challenges and gratifications. It's always a challenge to keep a balance of service providers and service recipients, to make sure that the service providers are getting the number of hours they want and the recipients are all able to get the services they need. And then there's service provider training, annual training that is mandatory through Department of Human Services, as well as just keeping up on our department and paperwork changes and things like that. Gratifications, just a real joy about being in this job for both me and the service providers is how much recipients value and appreciate this program and provide feedback. And then the service providers also. It's like one said, it's not a glorified maid. She said that even though you're going into the home and providing homemaking, for instance, it's that relationship that develops between the provider and the recipient, and that sense of making a difference in someone's life. And so get lots and lots of great feedback. Just a couple examples I put up there. Service recipient, I don't know where I'd be without your program. Service provider, I really do fall in love with the people I come in contact with. So that's kind of the gist of what I put together, and I'm willing to take questions. We need to get how to get this screen back up so I can. I had to minimize your screen in order to get the PowerPoint. Oops. Sarah, any? Let's see if I.
There we go. You're down again. All right, so we will go through roll call for questions for Anita. Myron?
None. Thanks for all you do. That was very informative. It's good to know that we're providing these services to those people that need it, especially our elderly.
Thank you.
Andrea?
No questions. That was a great presentation. Thanks.
Thank you.
Roger?
No questions, but Anita, thanks for all you're doing and for what the program is doing. It's a wonderful service for our community. Appreciate it.
Thank you. Thank you to all of you too for the wonderful service you provide.
David?
Hey, thanks, Anita. The great presentation. I do have 3 questions. And so going through, well, I guess the first one, how are the payments set? That's set through the state, is that right?
Yes, it's based on what the waiver, which is through Department of Human Services. Mm-hmm.
Are you familiar with? And then they just kind of tell you how it is. Is that more or less?
Pretty much, yeah.
Is there a way to give feedback on that, or do we have an avenue to? Is there a way to have a conversation about that?
I've tried, and I guess it doesn't really. I don't understand why the waivers aren't at the same rate, other than I think they determine certain people maybe need more intensive services.
Yeah, I was just thinking about, as an independent contractor, thinking about those rates and thinking about people making a living and paying, self-employment taxes with those rates and just the challenges there. And I could see that being a really a big challenge for providers to make that work. And the importance of this program is incredible. So I was just curious about that. But
Yeah.
yeah, I'm
Oh,
sorry.
no, that's my heart too. And it really, the people who work in this are really wonderful, qualified people. I mean, some have bachelor's degrees and graduate coursework or extensive experience working in hotel industry and restaurant, but you know, 2-year degrees. They're really qualified, committed people. So it's wonderful and amazing when you do think about the wage. Yeah.
Yeah. And so then just so I understand, the when they're qualified, but then because of say age or disability, and then but then they're only qualified for the private pay, is the main purpose then just to make those connections between providers and recipients? Like otherwise a recipient say could just advertise on their own to find somebody to give whatever service they need, right? But the real benefit of the program is making those connections, even though it is out of their own pocket with private pay.
Well, I think a part of the benefit for them is knowing that the person that will be working with them has been thoroughly screened, has gone through a background study, including fingerprinting, has regular training. And if that person becomes unavailable, then my role is to find another person to replace them, whether it's temporarily or long-term. So it takes some stress off of them.
Yeah, no, I can see that. That makes sense. Thank you. And then just for my final question, what you mentioned one of the challenges is just the training, and I was wondering if you could go a little deeper there on why training is a challenge. Is it timing and coordination, or is funding an issue, or where are the challenges there?
Probably timing and coordination would be the biggest thing. And just ensuring that within the amount of time that we have, that licensure requirements are being met, as well as things that just come up that we need to communicate as a department. So having enough time to squeeze it all in and getting it, you know, for the in-person trainings, being able to find a day and time to get everybody that they can, as many as possible can come together for that training. We had a training scheduled for the end of March, which an in-person one, so it was canceled. And then a COVID-19 certification, caregiver certification, nationwide certification came available. And that actually, some of the things in that met licensure requirements. So that was an online training. So we were able to provide that in lieu of the March training. So yeah, does that answer your?
Yeah, thank you very much for the presentation and invaluable service.
Thank you.
Thanks, Dave. Bobby, any questions?
No questions. Thanks for the presentation.
Thanks, Bobby. Ginny, any questions?
Yes, just a couple of points. So Anita, is this support program the only one in the county? Either private or countywide?
Yes. Yes, it is. Well, yes, it is. Finland
Okay.
is starting something, but that's technically Lake County, but it's sort of on the edge of our county. Yeah.
Right. So is it age 65 and older, or younger than 65 on disability? Is 65 the magic way you get into the program?
Kinda, yeah. I guess if you don't have a disability, you know, or medical condition. I guess in a sense, if you don't have either a disability or a medical situation where you have those needs.
Mm-hmm.
It's kind of
Okay, I didn't know if it was either or.
oh, no. Right, it's both. It's 65 or older, whether you have a disability or not. And under 65 would be with a disability. Either
Okay, all right, very good. Mm-hmm. Okay, great, thanks. It was a good program, a good updating. You know, we get this maybe every year or year and a half. And it's always good for updating for us because I'm sure it updates for all of the different entities of public health quite often. So thank you for the presentation.
Thank you, Ginny. Thank you, Anita. Have a good day trying to get everyone in the right boxes.
Thank you. You have a good day too. Thank you for inviting me.
Yep. Okay, so this is why we always have Molly. So Molly can remind me that I can't just say we're doing electronic meetings because of the COVID. So before we move on to Allison, I'm going to read the official notice because, you know, that's what we should do. We should be professional. So we have determined an in-person meeting or meeting conducted under section 13D.02 is not practical or prudent because of the COVID-19 health pandemic and the related state and local declarations of emergency declared under chapter 12. The technology we are using allows that all members of the body participating in the meeting, wherever their physical location, can hear one another and can hear all discussion and testimony. It also allows that members of the public present at the regular meeting location of the body and they can hear all discussion and testimony and all votes of the members of the body. Commissioner DeShaw and Interim Administrator Rena Rogers are physically present at the regular meeting location and all votes are done by roll call. So each member's vote on each issue can be identified and recorded. Doesn't that sound so much better than just how I said it? You all know I don't talk like that. Thank you, Molly. All right, Allison, we have director's report. Are you ready?
I'm ready. Good morning, everyone. It's good to be back with you all again. I am just 2 weeks into my return from family leave, so I'm still very much in catch-up mode right now, but glad to be here with you all this morning and to give an update from the PHHS department. So you all met Kristen this morning. We are so excited to have her on board supporting our public health team in emergency preparedness and then supporting the goals of our community health assessment and health improvement plan as well. So Kristen's hire was approved at the last regular board meeting. She started yesterday with orientation with Grace at PHHS. You've also been hearing regular updates from Grace and the EOC at your board meetings, but also want to remind you all that Grace is also working with an AmeriCorps member. Elsa Lundy has been brought on to support the EOC with issues related to food access. So as far as a staffing update, those are the two biggest changes in the PHHS department. I really want to start out by just recognizing all of the staff within the PHHS department for what they've done over the last several weeks in maintaining services, in many cases responding to increased requests for services, all the while completely changing the way that we do business as a department and working primarily from home, connecting with clients by video and by phone, and putting really strong procedures into place for when a meeting in the office is necessary, just to ensure that both any members of the public coming into the office and our staff have been screened for health risk. And this is all not to mention all of the individual and family stressors that we're all navigating as well at this time. So just want to express my gratitude to everyone in the PHHS department for really stepping up. And this is with a lot of change coming down from the state and federal level, as you heard in Anita's presentation. We are getting a lot of directive from the state, but we're having to kind of pave our own path in some ways as well, and making sure that we're providing the best level of service while ensuring safety. And the team is really showing up for each other in a lot of ways. That's really remarkable, and really maintaining a spirit of togetherness despite the physical absence or the physical distance that we're having to take. Really want to thank the management team in particular, the supervisors and Sarah Hadley for really stepping up in my absence and allowing me to disconnect as much as possible for the last several weeks. So thank you to all of the staff and supervisors in PHHS. I'll spend the rest of my report just giving a little update from each of the individual units in the department. Within social services, our adult and home and community-based unit is just about back to fully staffed, with Olivia returning last Monday. Working remotely for the staff is a particular challenge based on the programs that they're working with, the state programs. They have to use fax quite a bit in corresponding with physicians and other agencies. And they're very tied to their paperwork and paper files. So that staff has had to really navigate a lot of change, in particular, just because of, again, the programs that they're working with. Our mental health caseloads are very high right now, both adult and children's mental health. Both of those case managers, Jade and Anna, are at their limits, which are set by the state for the number of clients that they can have on their caseload. So that team has had to get creative with how they're managing that increased caseload and really ensuring that anyone requesting services is able to receive those. So Cooper, who is also recently returned, has taken on a small mental health caseload as well. Primarily, or Cooper in the past has been a child welfare worker. So he's diversifying his caseload just to make sure that needs are met. And as I'm sure you all know, the stressors are just really amplified right now for the families and individuals that we work with because of the pandemic. And we know that this is really a long-term effect, that this is unlike any other crisis where the effects will be felt long-term. So that's something that we're really working to be intentional about within our mental health services, and thinking about how can we sustain services and meet the needs of the people we serve here in Cook County. Within income maintenance, the number of intakes or requests for applications within this area has leveled off or slowed down from the initial increase for applications this spring, when people were out of work and were waiting for unemployment insurance to come through. So that staff is back to something, some semblance of normal in terms of the number of requests that they're getting, the number of applications, but they're also having to stay on top of a lot of changes from the state in terms of the program modifications and waivers that are being put in place to ensure ongoing eligibility for people, especially medical assistants. The governor's executive orders have included provisions for ensuring ongoing coverage for medical assistants. So a lot of manual workarounds for the staff, a lot of communication coming from the state. And then they're anticipating after this, after these expire, a lot of cleanup work to have to go in and close any cases that should no longer be open. Let's see, within public health, again, I know you've been receiving regular weekly updates from Grace Grenager in your meetings, and she's really doing a phenomenal job both in communicating with you all, but with the public as well. So I don't have much to share from public health this morning. You'll get an update from Grace at your special meeting later this morning. But she is really dedicating almost all of her hours to emergency response and planning, as well as onboarding a new employee and the AmeriCorps member. So really just want to recognize Grace for everything that she's done, for the leadership that she's provided in this really uniquely challenging time. So thank you, Grace. In the admin and fiscal area, those staff are rotating shifts currently, just to ensure coverage in the office. At least one staff member from our administrative support team and from the fiscal area are in the office on a given day, and that's just to ensure that those essential tasks are covered, and that includes manning the phones, covering the phones, processing mail, scanning and receiving documents, issuing EBT cards, food and gas cards, And staff from both of these teams have also been providing critical support to the EOC, Plummen in managing donations, Lori in logistics, and Sarah Schoonover in providing administrative support to the EOC. Sarah Hadley is continuing on with her temporary project to provide treatment coordination to persons in need of outpatient or residential treatment services. So again, Sarah continues to go above and beyond in working through that project, providing really critical support at this time to people when it's more difficult than ever to access treatment services, especially residential treatment services out of the county. Greg in the Wilderness Outpatient Treatment Program is continuing to provide Rule 25 assessments. He's conducting those face-to-face in the office at PHHS. He's also offering those by Zoom or other telepresence methods or by phone. He's also been traveling to the jail to conduct Rule 25 assessments. Greg is also in the process of resuming face-to-face outpatient treatment as well, doing that on a one-on-one basis, again, just to ensure the safety for himself and for the participants in the group. He's also making the option available to do that or continue doing that by Zoom for participants. Greg's really described the last few months as really difficult to maintain the connections with the people he serves through the program, just the nature of the disease of substance use disorder and the nature of the times and how hard it is to stay connected, that he's really looking forward to resuming that one-on-one treatment in the office with folks. Greg is also going to be coordinating with Grand Portage Human Services staff to offer the evals and the individual treatment at Grand Portage Human Services. You heard a great update from Anita this morning about the various changes that she's implemented for the in-home support program to resume medical inshore rides for the recipients of that program as well. And again, want to commend Anita for everything she's done working with the state and with other program providers in the region, just to make sure that we're consistent with their safety protocols and that we're able to resume services safely. That's all I have for updates from the agency. Unless there are questions, I'll just say a note too about our items for board action. We have resignations for 3 of our local advisory council members. Those resignations came in over the last several months, but we discussed, our chair, Andrea Orest, had the really great idea, and we discussed at the council meeting last week the development of an exit survey to just better understand why folks are leaving the council, knowing that there are many different ways that people are having to reevaluate their priorities right now, and it can be difficult to remain committed. But if there's anything that we as a membership can do to really improve and retain members in that council, that we're in the process of developing and revising an exit checklist or interview for outgoing members.
Thank you, Allison. We'll do a roll call for questions for Allison. Myron?
I don't have any questions, and welcome back, and thanks to all your staff and you for this very, very important service, especially in these times, but at all times. It's really hard, I'm sure, and stressful at times to really go beyond some of the capabilities we have in staffing, but it sounds like you're doing the best you can, and really commend all of you for your efforts.
Thank you.
Dave?
Thank you, Madam Chair, and thank you, Allison, for the updates. I don't think, welcome back. I'm really happy to see you. It's really happy to see you at the CHB meeting as well. I don't have any questions right now.
Roger, it looks like your cat is photobombing. Does the cat have anything to say to Allison this morning?
No, he just says thanks. He appreciates it. thanks for the report, Allison. It sounds like everybody's working really hard as they always do. Appreciate their work.
Andrea,
No questions. Thank you.
Bobby,
Yeah, thanks for the report. That was one of the questions I had at the board meeting last week, was with the wilderness outpatients, making sure that people are getting their services, and sounds like they are, so thanks.
Thank you.
Ginny, any questions?
No questions, just a big thanks for everybody doing above and beyond what would be normally done, and welcome back, Allison.
Thank you.
Allison, try to get this into the easiest. So we're at capacity in some of our programs and we're mandated by the state for staffing. And so what is the normal response when we meet capacity? When do we have to add to staffing? And are there any adjustments for us during COVID as an understanding? Do we still have to meet the same requirements? Where are we looking at? Are we looking at possibly getting a reduction in funding because we're not meeting the standards?
That's a really good question. And as you know, is really complicated based on the fact that these positions, in many cases, especially in mental health, are revenue generating positions. So if we don't have enough staff to provide the services, that limits the amount of revenue that we can capture. And it's finding that balance as we've worked to over the last several years in ensuring that we have enough staff both to meet the level of need, but to bring revenue into our department to do the work. And that's on both the front end in terms of providing the direct services and doing the documentation, but on the administrative back end as well in billing for those services. So it's something going into 2021 budget that we're looking at, knowing that it's complicated by many other factors as well, potentially reduced revenue on the state level, not for these billable services, but just in general. So I know it's something that Lori Erickson, our fiscal supervisor, is really considering going into 21. How can we maintain services knowing that revenues may decrease, but also from a staffing standpoint, how do we make sure that we have the right number of staff to meet needs, and knowing that a lot of these positions are funded at least at 50% in terms of the billing.
Thank you for, I know that's not an easy question to answer, and it's something we're gonna have to look at going forward. And so tough times, because we do know that a lot of it is impacted by the COVID, and we know that we can't determine when those things will change and what the long-term impact is, and what we've talked on our mental health advisory, what the triggers are and how those triggers play out. And for some, it's a one-time event, and for others, it's a long-standing. And your team has really done a lot to step up with the community phone line and other things for availability. So thank you in this ever-changing, crazy culture to still provide to the community. It means a lot. So moving on, we do have items for board action, and we do have the 3 resignations. So could I get a motion to accept those resignations? And just a reminder, it's Lynn Salisbury, Lori Oswald, and Jim Boyd who needed to step down from our mental health advisory committee.
I move that we.
Go ahead, Roger. So we've got Roger as the motion and Dave as the second. And then we will do a roll call for the vote. Roger, did you have something else?
Yeah, I was going to say, could we add with regret? I'm
Absolutely.
Those are
absolutely. Good folks. They were. It'll be a huge impact. So Myron?
Aye.
Dave?
Aye.
Ginny?
Aye.
Bobby?
Aye.
Roger?
Aye.
Andrea?
Aye.
And I'm also aye, so that is unanimous. Allison, did you have anything else before I move into committee reports?
I don't, unless there are any other questions for me.
Okay. So committee reports, Arrowhead Economic Opportunity, Dave.
We meet tomorrow.
Okay. And Arrowhead Health Alliance, Dave.
We have not met since our last meeting, but just going over the minutes from our last meeting. I failed to mention that there's an anticipated increase to our membership of $1,000, which is significant. I think that increases our chip in our share by 50%, and versus $1,000 in our entire budget is not a huge impact. Just that percent increase is significant, and that's largely to do for health insurance purposes for staff for the AHA. And the reason that was brought back to my mind was because of potential increases with also the CHB membership. You know, most of the costs and benefits, for that matter, go to the larger counties, and we're kind of one of the smaller fish, and so they're really taking the brunt of it. But it is all relative, and our percentage and portion, you know, it will be increasing, but the benefits we get from either one of those organizations far outweigh the costs. But I just wanted to bring that to everyone's attention.
Thanks, Dave. Arrowhead Regional Council, Ginny.
We did meet, however, nothing that that I would need to pass on. But I would like to just mention that last week I attended a webinar from AMC Health Steering Committee, and just a little background on what happened in March. They developed a Blue Ribbon Commission, and this commission has been working very hard from the beginning of March to now ask the legislatures who convened on Friday the 12th to pass a ramping down of COVID-related waivers and modifications of at least 60 days to ensure that transitioning of the practices will be done in a responsible way. And I won't go into all the details, but there are about 15 different waivers that they've asked the legislatures to look at. I don't know where that's progressing. I haven't had a report lately. Usually AMC will be sending out something to all of us. And according to a couple of the legislatures, they want to be done by Friday. So, you know, I don't know where this is going. Keep our fingers crossed that somebody will address this across the state and all the counties. Thank you.
Thanks, Ginny. Going back, Bobby, Arrowhead Regional Corrections. Sorry, there's way too many arrowheads in a row.
We meet tomorrow or on Friday.
Going down there, or are you doing it by Zoom?
We're Zooming.
Sweet. All right, Community Health Board, Dave.
Yes, thank you. Yeah, as I said, the meeting kind of flew by, and I was anticipating some tension because of the potential increases, and there wasn't as much controversy as I was expecting, especially considering that we had such a, I don't know if discussion's the right word, we were really waiting on St. Louis County on whether or not they wanted to stay in the CHB, and now with these potential increases, I don't know if they saw it coming or if they just accepted or what, but there was some questions asked by the St. Louis County Commissioners, and you know, one of the big factors in this increase is the state to this point has allowed unspent grant dollars to be carried over into the next year. And Susan Michaels, the current our new CHB director, is coming from the state, saying that may not be a good way to go. At any point, they could say, you have extra money, we're taking it back. And so it's in the CHB's best interest to use that money rather than carrying it over every year. And so this is it would be a bit of an adjustment, but I respect her perspective there, and nothing is set here. She just kind of wanted to get in front of it and have the discussion, and that was the big takeaway for me. And Allison, I know you are still getting caught up to speed, and I don't know if you have more to add on that, or if there's more we should be concerned about there. But that was kind of
Dave, this is Grace. I think that was a pretty good recap of what happened at the last CHB board meeting.
I think it's good to have advance notice that the financial situation for the CHB is changing. But I don't think there's anything else to report at this time. Like you said, I think it was more of a heads up.
Thank you for that team report. And we'll just wait and see, as we often do when we have a partnership, and we won't mention any names who make things interesting for us. Public Health and Human Service Advisory Council, Roger.
We have not met since our June meeting or our May meeting, and we will meet in July. That's all.
Thank you. Andrea, Mental Health Advisory.
Yeah, we met on June 9th, and like Allison already mentioned, we're working on the exit survey to assist in our evaluation of the group's inclusivity and goals. We've received an update from James at Sawtooth Mountain Clinic on their telehealth progress and their plans to continue that post-pandemic, whatever that actually means, because they were in the process of working on that program anyways. We also talked about the success of the radio segment for Mental Health Awareness Month and the plans to continue to bring mental health to the forefront via the radio. We're working on some PSAs to present to the group at the next meeting, and then working with Carly Puck on what we're right now calling a Mindfulness Monday project. I don't know if that name will stay, but that's sort of what we're working on. Would be a 5-minute segment every other Monday to bring mindfulness to the community and present it as what it is, instead of, to help break the stigma around mindfulness. We received the same update on from Public Health and Chemical Dependency that Allison presented. And we received an update from the Cook County Early Childcare Coalition and their collaboration with Lake County to continue working on the service gaps in rural areas. And then Allison presented her master's presentation on co-creating self and community care in Cook County, which was really great. Thank you, Allison. And that's all of the updates.
Great, thank you, Andrea.
Yeah.
Healthcare Planning Committee, Ginny.
Yes, we always meet the first Friday of the month, unless something happens that we all can't do it. So a little updating here, Care Partners continues to do deliveries for clients from Grand Portage, and Jen Sorensen reported that the Tribal Council has decided to post 2 positions, Health Service Director and Human Service Director. So there's 2 different areas there they've divided out. North Shore Healthcare Foundation, Valerie, said that they're in the process of moving their offices to a new location. So we will wait and find out where we can find them in the future. From the Sawtooth Mountain Clinic, Kate Serba keeps encouraging all of us to remember that community services are still being offered at the clinic, and for the community to stay up to date with preventative and health routines and behavioral health science services are still available to the community. So just because there's all of this other stuff mingling with us, we need to keep up with our immediate health cares also. And Violence Prevention Center, Lindsay reported that they're still providing services remotely when possible, but setting up appointments when needed. And that's my report.
Thank you, Jenny. North Shore Collaborative, Dave. Dave, your microphone was awful.
Louder?
No.
It's just the quality?
Yeah. Sounds like you have aliens trying to eat you.
Change? Like, from before meeting and now? Well, I haven't changed.
All right. Hopefully that gets fixed before committee of the whole. Emergency preparedness, we'll have Myron present because he always sounds lovely.
That's interesting because I had another meeting that I had to be involved with as board chair, so I wasn't there. That Commissioner Mills was there as well as Administrator Rogers. So I would defer to one of those two.
Let's have Rena do the update. Not that I don't want to hear from Dave, but.
So we've been meeting every 2 weeks, and largely what we've been doing is just providing updates on what everybody's doing, you know, in response to this emergency, COVID, and any updates on other things that might have been an issue. Certainly over the last month, we were worried about fire danger, and so we got updates on those kind of emergency preparedness things as well. But mostly they've been updates, you know, where people are at in terms of opening or not opening, hospital updates, public health updates. City does updates on how they're opening up the campground or not, or what the issues are. So it's kind of general, everybody keeping in touch. Nothing, I don't know, Grace is on here too. Nothing stands out to me as significant other than just general exchange of information. We do meet again this afternoon. This is our week to meet. So see how that goes. Now that we have a case, that'll be something different to discuss.
Okay, Dave, let's give you a shot.
How does it sound?
Much better.
I didn't do anything, but
okay.
Still. But one thing that was discussed at our last EOC meeting was just in regards to the happenings down in Minneapolis and nationwide, and just some discussion about where we're at in our county with public safety and awareness around that issue. So and I think it's good to have that discussion and for us to be aware of it. And I know our public safety officers are in conversation with the rest of the state about what's going on. And so that was one other kind of big thing being discussed.
Thank you, Dave. Our last wonderful item for the good of the order. We have a huge good of the order. Mr. Deshaw, congratulations. You are the new tribal chair for Grand Portage. So we've got that. Does anyone else have for the good of the order?
Madam Chair.
Yep.
I would like to present an happening at the North Shore Health, the development of a Serenity Garden. And there's a group of folks who have decided that it would be really nice in the center when you're sitting in the cafe area to look outside to see a calming group of plantings and benches and pots of flowers and that type of thing. So this summer, they're just going to start hardscaping with paths and seating areas, and then next year to do the shrubbery and perennials and colorful flowers. So there's a group of folks who have put this together, and they've already had a meeting. They have a mission statement, and it's going to move forward. Hopefully I can join them at some point and be part of the Serenity.
That is wonderful news. Thank you, Jenny. Does anyone else have anything for the good of the order? All right, I have one last for the good of the order, kind of taking off of Commissioner Mills. I just want to thank our public safety team and just remind the community that our law enforcement officers are there to serve and protect. And their first line of response is always to talk things through with the committee. They have a lot of training in working with the public and not responding in a harsh or violent manner, even though they have a very difficult job and need to assess every situation individually. They have continued training. They have a code of conduct that they go by, and they very much back and support each other and help each other out. And huge shout out to them. And I hope that the community remembers to smile and wave when they see them going by. They're not always trying to pull you over. But as I know, because many of you have pointed out my speeding issue, if I get pulled over, it's my fault. And so I will try my best to respect them when they pull me over. Yes, Rena, shake your head. But we must say that they are wonderful people. And I see Molly smiling because I know she has to work with them and it's a difficult job. So Allison did a huge good of the order shout out to her staff. And as always, a shout out to all of our wonderful staff. We are in strange and interesting times right now, and we are all pushed to our limits, and that includes our county commissioners and other people. So thank you for meeting those limits and going beyond and always providing the best service to our community. You guys are all rock stars. And with that, I will ask for a motion to adjourn, and we will leave this Zoom meeting after adjournment, and then we will have to reconvene in another meeting for the next meeting if everyone follows all of that.
I so move we close the meeting, adjourn the meeting.
Okay, and we have Dave as the second.
Second.
All right, and we'll do a roll call on if everyone approves to adjourn. Andrea.
Aye.
Roger.
Aye.
Bobby.
Aye.
Ginny.
Aye.
Dave.
Aye.
Myron.
Aye.
And I. So that is all ayes for adjournment. Have a great day, everyone.
Thank you.
Thank you.
Thank you.
Bye.